Hello friends, the topic of this video is Azygos vein. You may be asked to write a short note on Azygos vein in your exams, and your answer should be written under the following headings: how it is formed, then its course, its tributaries, and the relevant clinical or applied anatomy. You always start your answer with a brief introduction. So, the azygous vein, what is it? It is an unpaired vein which is present on the right side of the body. And here we can see this is the azygous vein. Similar vein is not present on the left side. So, it is unpaired. Now, here this is the superior vena cava and this is the inferior vena cava. It is paravertebral in position. You can see on the sides of the vertebra, it lies there. Then it is not accompanied by corresponding arteries. Usually the deep veins, they accompany arteries, but here we don't have any artery accompanying it. And it drains the posterior thoracic wall and also the posterior abdominal wall, its upper part. That also is drained by the azygous vein. Now the azygous vein communicates with the superior vena cava above because it drains into superior vena cava. It is a tributary of superior vena cava, which we can see here, and sometimes it is connected to inferior vena cava also. The relevance of this we will see in the clinical anatomy part. Then second is that it is also connected to the portal vein. So portal venous system also it is connected. We can see here this is the esophagus, this is stomach. Here we have this is the azygous vein, right? So here the esophageal veins, they are draining into the azygous vein, and from the lowermost part of the esophagus, the veins they drain into left gastric vein, right, which is present in the abdomen and is a tributary of the portal vein. Now these veins which go into the azygous vein and the one which reach the portal vein via the left gastric vein, they anastomose in the esophagus. So because of this anastomosis, the azygous vein is also connected to portal vein. And the third is that it is also connected to internal and external vertebral venous plexus. So here we can say this is the azygous vein and its tributaries are these posterior intercostal veins. These posterior intercostal veins in turn, they are connected to the internal vertebral venous plexus, which we can see here. So these are the three communications of azygous vein. First is with the caval system, that is superior inferior vena cava. Second is with the portal system, that is with the portal vein, and third is with the vertebral venous plexus. Let us see how the azygous vein is formed. Where it is formed? It is formed on posterior abdominal wall. And we will also look at which veins unite to form the azygous vein, or which are the formative tributaries of azygous vein. Now in this diagram, if we look at, this will be present in the posterior thoracic wall here. So this is part of the thoracic wall. We can see here this is the diaphragm. So this will be the posterior abdominal wall where these veins are lying. Now here we can see this is inferior vena cava, which all of you must be knowing is formed by joining of two common iliac veins. And here we can see the renal veins also. This is the left renal vein and this is right renal vein. Now if we see here, we can see the three formative tributaries of azygous vein, and they are, this is lumbar azygous vein, this is right ascending lumbar vein, and this is the right subcostal vein. So this lumbar azygous vein, which is this vein is not always present. It may be present as a fibrous structure or may be absent also completely. Now this is the connection between the proper azygous vein and the inferior vena cava. So this could be the first tributary or the main tributary also. Then we have the ascending lumbar vein. This ascending lumbar vein actually below communicates with the common iliac vein also, and it forms a vertical anastomosis between the lumbar veins. These are the lumbar veins which will be draining the posterior abdominal wall. Usually there are four lumbar veins. Lower two drain directly into inferior vena cava, whereas upper two are usually the tributaries of ascending lumbar vein. So this ascending lumbar vein, it ascends up along the posterior abdominal wall deep to the psoas major muscle, and it is joined here just below the diaphragm by the right subcostal vein. So these three veins, by joining, they form the azygous vein. So these three veins are lumbar azygous vein, right ascending lumbar vein, and right subcostal vein. But sometimes the lumbar azygous vein may not be there. So in that case, the azygous vein will be formed by the union of right ascending lumbar vein and right subcostal vein. Let us now see the course of the azygous vein. So we know now the azygous vein is formed in the on the posterior abdominal wall. Now how it reaches the thoracic cavity here? Azygous vein leaves abdomen by passing through aortic opening of diaphragm. All of you must be knowing there are three main openings in the diaphragm. One is for inferior vena cava, another is for the structure that is esophagus, and the third one is for the descending aorta. So here we can actually see three structures which pass through the same hiatus, that is aortic opening, and these three structures are the descending aorta, thoracic duct, and the azygous vein. So it enters the posterior mediastinum by passing through the aortic opening in the diaphragm. This is present at the level of T12 vertebra. So once it will reach the posterior mediastinum, then it ascends up, and it ascends up till which vertebral level? Till the T4 vertebral level. So it will be present in the on the interior aspect of the vertebral column. So when it reaches the T4 vertebra, after that it arches over. You can see here it arches forward now over the root of the lung. You can see here the structures forming root of the lung. You can see a pulmonary veins can be seen, pulmonary artery, bronchus can be seen. So it arches over the root of the lung and makes an impression just above the hilum of the lung also. And it opens posteriorly into the superior vena cava just before the superior vena cava pierces the pericardium. So this is the course of azygous vein. Let us look at its tributaries now. So here the tributaries will be formative tributaries. So formative tributaries are mainly the right ascending lumbar vein or right subcostal vein. There can be a third tributary also, which I told you earlier, that is the lumbar azygous vein, right? So these are the formative tributaries. Don't forget to write them as tributaries. Then we have, when it is in the posterior mediastinum, it is going to receive 5th to 11th right posterior intercostal veins. They will all drain into azygous vein. And after that, it will also receive another vein which is known as right superior intercostal vein, and this is found by joining of 2nd, 3rd and 4th posterior intercostal veins, right? So you can see on that side, except the first posterior intercostal vein. The first posterior intercostal vein that directly opens into right brachiocephalic vein, right? So from 2nd onward, all posterior intercostal veins on the right side, they will be draining into azygous vein. Plus, in addition to that, it will also receive blood from the left side of the thoracic cavity and the upper part of the posterior abdominal wall through two veins, and these are, this is hemiazygos vein, which you can see here, right, which is again formed in the abdomen. We'll see its detail a little later. So this is the hemiazygos vein, and this turns towards the right side. It is present on the left side. It turns towards the right side to drain into azygous vein at the lower border of the body of T8 vertebra. So this is another major tributary of azygous vein. There is one more vein, and that is accessory hemiazygos. This is also present on the left side, and this will also turn towards the right side and drain into the azygous vein, and this is at the level of upper border of T8 vertebra. So upper border of body of T8 vertebra. So you can actually say that the hemiazygos vein is mirror image of the lower half of azygous vein, whereas the accessory hemiazygos vein is the mirror image of the upper part of the azygous vein on the left side. Then we have some more veins draining into it, and these are the right bronchial veins, which cannot be seen here. And there will be, we have already seen esophageal veins, they drain, then some mediastinal veins are there, and pericardial veins. They are also draining into the azygous vein. So these are the tributaries of azygous vein. Let us look at the hemiazygous vein. As I said, this is the mirror image of lower part of the azygous vein. So it is present on the left side. So you can see here on the left side how it is formed. It is formed again in the abdomen by union of, you can see here this one dotted one, this is the left lumbar azygous vein. Now in this case, this is connected to left renal vein, not to IVC. Right, on the right side, the lumbar azygous vein is connected directly to inferior vena cava, whereas on the left side it is connected to left renal vein. So this could be one of its formative tributary, right? And second, similar to the azygous vein, we will have on left side left ascending lumbar vein and left subcostal vein. Now this vein is going to pierce the left crus of the diaphragm and enters the posterior mediastinum. And after that, it is going to ascend till which vertebra? Till the T8 vertebra, and then turns to the right, and it passes behind the esophagus, the thoracic duct, the abdominal aorta. It passes behind all those structures to join the azygous vein. Its tributaries, formative tributaries, will be left subcostal vein, left ascending lumbar vein, and if present, the left lumbar azygous vein. It also receives 9 to 11th left posterior intercostal vein. So that's what you can see here. When it is in the posterior mediastinum, it is going to receive these 9, 10th and 11th posterior intercostal veins. Coming to accessory azygous vein, as I said earlier, this is mirror image of the upper part of the azygous vein on the left side. So here we can see this is our accessory azygous vein. So it is again present on the left side. Then where does it begin? It begins here at the medial end of the left fifth intercostal space, right? So you can say that the left fifth posterior intercostal vein, that is going to continue as the accessory azygous vein. So it begins in which intercostal space? The left fifth intercostal space on the posterior aspect. And then this is going to descend downwards till which vertebra? Till the T8 vertebra, then turns toward the right, passes behind esophagus, aorta and these structures, and will drain into azygous vein. What are its tributaries? The tributaries are 5th to 8th left posterior intercostal vein. So you can see here 4. So they will be draining into the accessory azygous vein. It's very simple to remember. On the left side, leave the upper 4. The first goes directly to the brachiocephalic vein. Second, third and fourth, they will join together to form left superior intercostal vein, which will be draining directly into the brachiocephalic. So upper 4, they drain into brachiocephalic. Middle 4 will form the accessory hemiazygos, and the lower 4, they will be draining into the hemiazygos. This is an easy way to remember. So on the right side it is different. The upper 4, the first one drains into right brachiocephalic, whereas second, third, fourth onto the right superior posterior intercostal vein, and from 5th to 11th plus the 12th, right? So lower 8 directly into the azygous vein. This is how you can remember. Accessory azygous vein may also receive left bronchial vein. Coming to applied anatomy. Now, what happens? Sometimes there can be a block in the superior vena cava. So then the collateral venous circulation, how it happens? We will be concerned mainly when the route of azygous vein is taken, because there are some other routes also which we will not consider in this video. So we are concerned here about how the azygous vein allows this collateral venous circulation. So let us first consider collateral venous circulation in case superior vena cava is compressed above the entry of azygous vein. So here we can see this is the azygous vein which will open. You can see it's a small opening on the posterior wall of the superior vena cava. This is superior vena cava. The block is here. So this is left brachiocephalic vein, this is right brachiocephalic vein. So it is before the opening of azygous vein if the block is there. Why the block will be there? Mainly it is compressed. It can be compressed because of the tumor, mediastinal tumor or lung tumor, right, which can press upon the superior vena cava there. So now let us see from the upper half of the body, right? This is here you can see the jugular veins, you can see the subclavian veins which will drain upper limb, jugular veins will drain head and neck. So now how the blood from the upper half of the body, which is usually taken by superior vena cava to the right atrium, how now this is going to reach the right atrium. So let us begin to see how it happens. So here actually if you can see, this is the subclavian vein here, right? So this is the subclavian vein and one of its branch is internal thoracic vein, not branch, sorry. Its tributary is internal thoracic vein. Branch is of arteries, tributaries are of vein. So here from the subclavian vein, the tributary is internal thoracic vein, which you can see here. Now the blood is going back, right? That is from the brachiocephalic vein, right? It will be reaching the subclavian vein and then the internal thoracic vein. So from the internal thoracic vein, then the blood will pass through its tributaries. Which tributaries? The anterior intercostal veins, right? So remember, there are tributaries of internal thoracic vein in each intercostal space, and these are anterior intercostal space. You can see here, you can see the light colored ones, right? These are the anterior intercostal veins, you can see, which are draining into internal thoracic. Now the reverse direction the blood is going. After that, the anterior intercostal vein, they form anastomosis with posterior intercostal vein, the darker in color. You can see here, these are the posterior intercostal veins. So they anastomose with each other. So now the blood will go to the posterior intercostal vein. And the posterior intercostal vein, where do they open? On the right side, they will open into azygous vein. And then the azygous vein, that is going to take the blood into the superior vena cava, and from the superior vena cava it will reach the right atrium. Similarly on the left side also the blood will go into the left internal thoracic vein, then anterior intercostal veins, then posterior intercostal vein, then accessory azygos and the hemiazygos veins, which again will drain into the azygos vein. So this is how it reaches. So briefly I'll state again, if there is a block in superior vena cava, obstruction is there, compression is there above the opening, the small blue colored opening in the of the azygous vein in the superior vena cava, then how the blood goes? The blood is going to flow backwards here, right? So blood which is coming from head and neck and from the upper limb, that will pass to the subclavian vein and to its tributaries, that is internal thoracic vein, then anterior intercostal vein, then which anastomose with posterior intercostal vein. Posterior intercostal veins are tributaries of azygous vein directly, or its tributaries accessory hemiazygos and hemiazygos vein. Ultimately the blood comes to azygos vein, then it takes the blood to superior vena cava beyond the obstruction, right, or distal to the obstruction, and then the blood reaches the right atrium. Now, second condition could be that the superior vena cava is compressed below the entry of the azygous vein. So here we can see there the block is now here, right, after the entry of azygous vein. So let us see now how the blood from upper part of the body is going to reach right atrium. So here the blood comes from the upper part, that is from the upper limb, head and neck region via the brachiocephalic veins to superior vena cava, and from the superior vena cava now the blood will go into the azygous vein. From the azygous vein it is going to go downwards and reach the right ascending lumbar vein, which we can see the anastomosis between the lumbar veins. Now blood will enter into the lumbar veins which open into the inferior vena cava. So blood goes into the inferior vena cava and which opens into the right atrium. So this is one course, right? So this is simple in this case. From the superior vena cava above the compression, from there blood goes to azygous vein. Azygous from azygos to right ascending lumbar vein, then to lumbar veins, then to inferior vena cava and right atrium. And there is another, if in case we have the lumbar azygos vein which directly connects the azygos vein to inferior vena cava, then it becomes very simple if this vein exists. Now the blood will go from superior vena cava to azygos vein, from azygos vein to lumbar azygos vein, and then to inferior vena cava. So they can be bypassed. You can see here from azygos vein to lumbar azygos vein and then to inferior vena cava. This is how the blood will reach the right atrium. So that's all for this video. Thanks for watching, and if you have not subscribed, please subscribe my channel so that I can put more such videos. And if you want the questions and answers in anatomy, all types of that, then visit the website, that is anatomyqa.com. Thanks once again.